Good afternoon. Thank you for joining us today. My name is Alex Key, Business Office Specialist with NCHA Strategic Partners. Thank you so much for joining us for today's webinar presented by NCHA Strategic Partners and Qualivis. Today, we are happy to have with us Qualivis, Worldwide HealthStaff, and Conexus MedStaff to help us learn more about international nursing options. A few logistics for today's session. We encourage participation, so feel free to ask questions throughout the presentation. To do this, simply type your question into the chat box in your toolbar, and one of the panelists will get to it. Additionally, we will have a formal Q&A session at the end for you to ask your questions as well. If you have any technical issues during the webinar, please chat the host or co-host, and we will assist you. Today's session is being recorded. NCHA will send attendees a link to the recording following the webinar. And now I will turn it over to Jody Fleming, President of NCHA Strategic Partners, to give an overview of Strategic Partners and our collaboration with Qualivis.
Thank you, Alex, and thank you everyone for joining us today on this very important topic. I know through the last 2 years, our hospitals have struggled with, finding enough nurses, whether they be RNs, LPNs, CNAs, medical assistants, but even also, like coders and dietary staff. So, we understand the shortages and we're here to help. So I wanted to just kind of give a quick overview of Strategic Partners. We are the shared solutions group for the North Carolina Healthcare Association. And we partner with organizations that bring value-added services to our member hospitals, help find a need, and we help fill in those gaps. One of those partnerships we have is with Qualivis. We've had a relationship with Qualivis since 2004. We were one of the first hospital associations / healthcare associations that developed a relationship with what was then called the South Carolina Hospital Association Staffing Services. And we've kind of grown up through the years with them. So at this time, I'd like to turn it over to Joe Dunmeyer with Qualivis to introduce the rest of our speakers for today. So thanks, Joe.
Excellent. Thank you, Jody. And thank you for everybody joining us today, especially our panelists, Mr. Tom Conitzer and Ron Hoppy. Good information for everybody that we hope is helpful. Certainly has been for previous webinars that we have provided. To Jody's point, Qualivis, we are the State Hospital Association founded solution for contingent workforce management. We have been in business. We were founded in 2002, so this is our 20th anniversary. It was founded by the South Carolina Hospital Association under a Duke Endowment grant, and 20 years later, it is now 27 states that endorse exclusively this contingent workforce management program. In 2021, we placed over 21,000 placements at hospitals throughout the 27 states that we service. We serviced over 1,500 hospitals. We currently have well over 11,000 placements on assignment. And we have 240 vendors that we manage under our program. They are screened, qualified, and vetted by Qualivis, and then brought to help staff the hospitals underneath this program. It is an emergent model hybrid MSP. Some people are familiar with MSP as a term, managed services provider, because we are not an agency. We are strictly a vendor neutral vendor manager. We provide full service of all contingent workforce needs under the program. And not only are our agency partners vetted and screened and qualified, but they are also made sure and coached and that they continue to do a good job for our member hospitals so that we can help you deliver on your bottom line. So our enhanced program services include clinical services, compliance management, consolidated invoicing and payment, business intelligence reporting, and Lotus Connect technology. We bring our own technology to the table, so we don't have to ask anybody else if they can make changes or improvements. It's all ours. All of this falls under the program, 100% under our management. This allows our member hospitals to continue with their duties at the hospital, ensuring job one patient care. And of course, standardized rates, which over the last couple of years has been especially important. Agencies, when there's opportunity, sometimes they can take advantage of it, but through our program, we have been able to manage those rates and frankly, have evidence on how we've kept them lower than the industry average during the pandemic. So we're quite proud of that. More so to today, we bring all service lines to the table. All of these that you see up here, of course, allied and travel staffing being the most utilized service line, but we also do locums, interim management, permanent placement, non-clinical, coding, to Jody's point, as she was mentioning earlier, crisis and rapid response, and then what brings us together today, international recruitment. Benefits really clear. I've seen them personally, but on both sides, from the clinical side and from a patient as well. The beauty of international recruitment is that there is a certainty of recruitment outcomes, and that is to say that, you know, with any other type of recruitment, you know, your marketing and advertising fees are just it's immense, and you know, you're not sure what you're going to receive on the other end of all of those efforts. Increased diversity, which is always a great thing. Improved retention. Again, I can tell you from a personal standpoint that when international recruits have the opportunity to come to the United States, they're so eternally grateful. Their retention rate is incredible. A reduced cost per hire. I'm sure most of you keep up with average costs per hire. The number I hear the most recently is about $40,000. And so our international recruitment folks are able to help keep that down by the people that they're bringing in. Experience in a variety of medical treatments and procedures. So these people are coming in from countries that have a great and different approach, and to be able to share that with their teams here in the United States is a wonderful thing. And please know, organizations like Johns Hopkins, Cleveland Clinic, Children's, National, they have organizations, they have hospitals throughout the world. That is an example of where these nurses are working now and being brought here to the United States. So they are coming from the state-of-the-art settings and equipment, electronic medical records. Tom and Ron will talk a little bit more about that, but these are experienced nurses. They, of course, pass the NCLEX exam to get to work, and specialties from across the gambit. So a little bit further down the funnel here, there are two distinct models for international recruitment. One is contract hire, or direct hire, if you will. That is where the recruits become a member of your team right off the bat. And then there is the indirect model where, or that's the contract hire, as it said, where they're temp to perm. And so Tom and Ron cover both of these with their respective organizations. We're going to start off with Mr. Tom Conexus at Conexus MedStaff to tell you a little bit about the indirect model and their company. So Tom, take it.
Great, thanks, Joe. And Jody and Alex, thanks for having me today. And whoever attended, thanks for being here. Joe, if you can just bump it to the next slide. Conexus MedStaff. If someone asked me, what are you and what do you do? I would say we're a turnkey international nurse and medical technologist recruitment and staffing firm that helps people realize their American dream. So these individuals want to come to the States and stay here. They're not coming to work one assignment and then go back to their home country. They're looking to stay here indefinitely. Many of them end up becoming US citizens, and it's their dream to come here and start a new life and better for themselves. I'm going to talk to you today about, yes, the contingent staffing model or indirect hire or temp to perm, however you want to call it. But with this model, we handle recruitment, immigration, licensing, credentialing, deployment, mobilization, and then ongoing support for our healthcare professionals. Really, the benefit of this model is there's very minimal risk to partner with us. There's no upfront or back end fees. You just pay for each hour that the nurse works, and I'll get into the hours here in just a minute. So very minimal risk. I'm out of Charlotte, North Carolina, and we also have an office in Houston, Texas, Lexington, Kentucky. We have a recruitment hub over in the UK, and then we also have an office in the Philippines. To our knowledge, there's no other country on earth that has a surplus of nurses or medical technologists like the Philippines does. And so about 50% of our nurses are from there. I'd say about 75, 80% of our medical technologists are from the Philippines. Joe, we can go ahead and move to the next slide. Our goal and what we do for these individuals, these healthcare professionals, is get them a green card. So you might hear it known as an EB3 visa, which stands for employment-based category 3. You might hear it known as a permanent residency card. I'll just refer to it as a green card today. And why that's good for you all, again, it lets an individual stay here in this country indefinitely and work for any employer that they choose. One thing to mention, I know this came up earlier on the conversation, is not only does the healthcare professional get a green card, but all the family members do too. So we have a lot of spouses and family members that go to work directly for our clients in places like IT, food service, housekeeping, working as certified nurse aides, sitters, things in that capacity that you're able to hire directly on. Since we're the sponsor, these healthcare professionals need to work underneath our umbrella for a certain period of time. And what we do is we put them on either a 5,000 hour for registered nurses, a 5,000 hour or a 6,000 hour assignment. And the difference between the two is 5,000 hours for anyone that comes to us having passed their NCLEX exam. For anyone who has not passed it yet and needs help in that process and needs us to fly them to a testing center, we put them on a 6,000 hour assignment because there's quite a bit more investment on those individuals. What it does lead to, though, is basically retention, reliability, quality, stability, continuity of staff, continuity of care with a predictable spend. And so 96% of our nurses complete their 5,000 or 6,000 hour assignment. We put medical technologists on a 3-year assignment. Takes a little bit longer to get a green card for a medical technologist, but 98% of our med techs finish their 3-year assignment. And then after that period of time, what we want to have happen is you just hire them on. They've been so embedded in the community, vested in your organization, that you hire them directly on as a full-time employee with no transition, no placement fee. And we have an 85% success rate of that happening with these individuals. So let's see, Joe, we can move to the next slide. Let's talk about some of the countries where we're getting these individuals from. I mentioned the Philippines. A few other nations that kind of stand out would be Caribbean nations like Jamaica, African nations like Nigeria, Kenya, Zimbabwe, Ghana, Uganda, South Africa. And then you get far out east to countries like Nepal, South Korea, Malaysia, Singapore, or to name a few others. When we provide and we present you with candidates, it's up to you if you want to interview them or not. And they're exclusive to your facility. We don't take one nurse or med tech and provide them to 3 different clients at one time and say, go to it. No, you have first right refusal on them. And then also on another standpoint, any healthcare candidates that we're presenting to you, you would not be able to get a hold of anywhere else. So candidates that come from my organization, they would not be the same ones that Ron would have, and vice versa. Anyone that Ron presents to you would be different candidates from our organization. So we do have some clients that participate in both models, just to kind of let you know. Each of our nurses and medical technologists are teamed up with what we call an engagement manager. And then our nurses are also teamed up with a clinical nurse educator. And this is before, during, and even after their assignment. We want to make sure that they're successful. We put them in housing for their first 30 days. We give them a $1,000 deployment bonus. And that very first week, we're with them to do things like open up a bank account, get a cell phone, take them to the Social Security Administration office so we can make sure they get their North Carolina RN license, Walmart, Target, housing, grocery needs. Transportation is a big one. We help get their children enrolled in school, help them find a church community, and then try to buddy them up with somebody from their same nationality. We don't have a minimum or maximum that you have to secure from us, but kind of best practices show we recommend probably at least 4 per facility, as they really do come to rely on each other and help each other out. And it stands for you to be more successful in holding on to those individuals when their time is done working underneath our umbrella. So let's see, yes, a little bit here. Again, no upfront or back end fees with this model. Assignment length is 5,000 or 6,000 hours for registered nurses. Bill rates really depends on, they're significantly lower than travel. If you're interested in finding out, it really depends on the county that you're in. And it's done, I'm not going to bore you with how it's done, but I'm happy to share the details with you on what that rate would be for your particular county. Medical technologists, we do put on a 3-year assignment, and those bill rates would be between $65 to $68 an hour. I know there's going to be some question and answer at the end, so please ask Ron or myself, and if anyone is interested in having a little bit more in depth on this particular model, happy to arrange that with you. So thanks everyone for your time.
Excellent, Tom. Thanks so very much. And I advanced the slide just a bit too quick there. Mr. Ron Hoppe with Worldwide HealthStaff to talk about the direct model and his organization.
Good, thank you, Joe, and good afternoon, everyone. It's a pleasure and a privilege to spend this time with you. I'd like to just begin by commending the North Carolina Hospital Association for hosting this event. It certainly is timely. And just as I was preparing yesterday afternoon for today, I received the most current North Carolina Nursing Journal magazine on my desk, and was interested to see a feature article talking about research work that has recently been done specifically in the state of North Carolina to determine exactly what the level of nursing shortage was going to be through to, I think, the year 2030 or 2033. So this certainly is an issue today. It has been an issue in the past, and all the data and research is indicating that this is a challenge that healthcare employers are going to have a plan to deal with going forward. Very succinctly stated, I think the challenges that the healthcare system is facing today are not so much recruiting challenges, rather they are supply and demand challenges. There simply aren't a sufficient number of qualified applicants to be available to fill the number of open positions. And this is where international recruitment in its various forms can make a very meaningful contribution to your overall medium to longer term staffing plans, in that international recruitment truly does add to the supply of available candidates in a particular region or in a particular geography. I also am located at our company's head office here in Charlotte, North Carolina, where for the last almost 24 years now, we have had a singular focus on connecting U.S. healthcare employers with experienced healthcare providers from around the world. The specific model of international recruitment that we offer to our employer clients and to applicants around the world is commonly referred to as direct hire or permanent placement. And as that title would suggest, the applicants that we will assist our clients to recruit will in fact become permanent employees directly hired by our clients who, upon arrival in the United States, are immediately added to your permanent core staff. These experienced care providers, when they do arrive, will receive the same pay and the same benefits that you would pay to any other similarly qualified domestic applicant, which it very immediately starts to provide you with a very meaningful cost savings opportunity relative to all other strategies that you may have to try to fill open positions, whether it's with your own internal staff, through overtime and various incentive payments, or through any number of contingent workforce strategies. In our model, our clients have access truly to an unconstrained pool of candidates. Our clients have the ability to interview any number of candidates that they wish to interview in order to fill the specific positions that they are looking to fill. Generally, the metric that we use with our clients is that for every position that you are looking to fill, our goal is to present you with two fully screened, fully vetted, qualified applicants for your consideration. We find that our clients are hiring at a much higher rate than that, but we also find that once clients are exposed to the applicant pool, they tend to want to interview and hire more candidates than they initially had planned to do. We did a recent recruitment event where I think in one day, the objective was to hire 25 nurses. I think the employer ended up extending 45 job offers. And when we asked the chief nursing officer, if we were authorized to actually send those offers out, the chief nursing officer responded by saying, "What are they going to do? Fire me for hiring nurses?" That was kind of an interesting experience. International recruitment, if anyone here has had experience in this realm in the last 10 or 15 years, many things have changed. If we were talking about international recruiting 12 or 15 years ago, perhaps, the conversation would have focused entirely on recruiting from the Philippines and recruiting from India. Today, India is no longer a viable, or is currently not a viable source country because of extensive visa processing delays there. And while many, as Tom referenced, while many of the nurses being recruited are Filipino nationals, in our case, we find that most of the Filipino nurses that we are recruiting are actually working in countries outside of the Philippines at the time that they are interviewed and hired. Today, our focus is, just back one slide for a second, Joe, please. Today, our focus is very much on the recruiting nurses working in the economically developed countries of the Middle East or the Gulf region. This is a very high priority recruitment geography for us, in that nurses and all health professionals working in that part of the world have come there from somewhere else. In this region, I would say at least 95% of the healthcare workforce, from physicians to nurses to all other disciplines, have come to work in this part of the world from literally all over the world, whether it's from Africa, other countries in the Middle East, certainly from the Philippines and Southeast Asia, as well as some candidates from Eastern Europe. These candidates generally are working in healthcare facilities that are more modern than they would be typically in a developing country such as the Philippines. They are working in facilities that much more closely resemble those facilities that each of us or each of you would be working at here in the US. A second benefit of recruiting in this part of the world, and it's a significant one, is that each of these individuals, or almost all of these individuals, have already made one international relocation in their career. So now, as they are looking to move on and continue on their career path to the United States, that second international relocation generally goes far more smoothly because of the experience that they've already had relocating from their home country to a new culture, to new work teammates, new environments, etc. So more specifically, when we're talking about the Gulf region, we're talking about countries like the United Arab Emirates, Qatar, Bahrain, increasingly in the last 10 years, even places like Saudi Arabia, where they have made massive investments in their healthcare infrastructure and facilities, and some other Middle East countries as well. Increasingly, we are finding that the UK is again a good source of candidates looking to work in the United States. Certainly, we do continue to recruit in the Philippines. There are some very excellent nurses there. Increasingly, there's Joint Commission accredited hospitals there. So Philippines remains an important component of the overall opportunity. And all of this is supplemented by lower levels of recruitment from Canada simply because of the size of the candidate pool. The bottom line to all of this is that we are able to expose you to a large pool of experienced healthcare professionals that have the ability to work in US-style medical facilities. Next slide, please, Joe. In the direct hire model that we offer and that we provide to our clients, our objective is to make international recruitment as seamless a process as it can possibly be. We greatly appreciate and respect the fact that everyone is fully maxed out these days, that healthcare organizations are continually being asked to do more with less. And incorporating a new staffing model probably isn't the first thing on everybody's list of things to do. So in our approach, we provide you with a single point of contact throughout the whole process. We have a team that, or teams that make up our overall team that will take responsibility for all aspects of the candidate sourcing, screening, facilitation of interviews, presentation of offers, and acceptance of offers. So we take care of all of that. We will arrange with you a plan to conduct interviews in whatever format is most convenient for you. We will share with you our best practices that we have learned over these years together with feedback from our clients. We are able to seamlessly also manage the entire immigration visa application process. Our team is responsible for all licensure, credentialing, and pre-orientation support services that we provide. And ultimately, when it comes time for that individual and their family to relocate to the US, we have a team here that is responsible for coordinating all the relocation logistics. We work with a number of vendor partners in this way with the ultimate goal of ensuring that the transition process is smooth for both the applicant and for you as their employer. Likewise, to what Tom shared, nurses arrive on a permanent residency visa. Key point, they never expire, they never need to be renewed, so you don't have monitoring issues to ensure that you have someone with an invalid visa, not an issue. And we will talk here in just a moment about the fact that while the conversation of international recruiting invariably revolves around registered nursing, as it well should, today employers, healthcare employers are embracing international recruitment for far more than just registered nurses. And at Worldwide Health Staff Solutions, we have clients that have looked to us for assistance recruiting not only registered nurses and MLTs, but that are availing themselves of our innovative nurse aid to RN program, increasingly looking to add to their radiology staff, as well as various support level positions as well. Virtually any position that you are having a difficult time filling, or where your vacancies continue to increase, can be addressed through international recruiting. Next slide, please, Joe. Here, just very simply and very transparently, is some fee amounts that you can use for budgeting purposes. The fees that we quote to our clients are all inclusive of all of the recruiting services, the immigration legal services, government fees, the cost of relocating the applicant to the US, cost of providing them with a 30-day temporary housing amount, and various other reimbursements. So the math is really simple as you're evaluating your various staffing options, both domestically and internationally. In our model, our candidates are all making a 3-year return of service commitment to you. So to determine your cost related to direct hire international recruiting, you would simply take the cost, your regular salary and benefit costs that you would offer to similarly qualified domestic applicant, add our flat fee to that one time to give you your total cost of employing that nurse for 3 years. Compare and contrast that with all the other alternative strategies that you may have at your disposal. And I'm confident that you will find that not only is international recruiting and direct hire international recruiting compelling from a quality and core staffing perspective, it also has a meaningful financial implication to the organization. Again, think beyond our ends. We certainly are. We're working with a large national organization to recruit pharmacists. Respiratory therapists are in huge demand, but a bit difficult. There's some licensure and regulatory issues, but environmental support staff, dietary support staff, respiratory, lab, and others, all occupations can be considered. We pride ourselves in our innovation that we have brought not only to our business, but to the industry over the years. And our business model is been developed and set up so that we have shared goals and shared risk with each and every one of our clients across the country. Next slide, Joe. Questions? So thank you for your time and attention. And like Tom, we look forward to hearing any questions that you may have.
Alex, you want to see if there's anything in the chat?
Yeah, I'm checking and I'm not seeing any questions at the moment. We'll give just a minute longer to see if any questions roll through. If you have any questions, please put them in the chat box and we will get to them right away.
Yeah. Alex, one question that I might have for those that are attending is just to see if anyone on the session today has been part of any type of international recruitment campaign in the past, either at their current or with the previous employer.
doesn't look like
some-
we have any responses to that question at the moment.
Okay.
I think it's still so new to so many people. I remember when I started in this industry about 30 years ago in the agency that I did work for at the time, we started our own international, and frankly, it was strictly Canadian, Ron. And 25, 30 years ago, there was a lot of opportunity to come to the United States. A lot of registered nurses had difficulty finding more than what they called casual employment in Canada at the time. And so the prospect of coming to the United States was very good. And but then things changed here in the United States and to Canada as well. And so there weren't as many coming down from Canada. And then, of course, here I'm on the non-agency side now. But it was very difficult back then as well. The hospitals were primarily responsible for the paperwork, the legal, the green card and visas, things of that nature. And the fact that the agencies, and especially both of yours, take care of, these hurdles. I think a lot of hospitals aren't aware of this, and that's why there's a lot more interest, not just because of the work that's being done for them, but certainly the need that we have.
Hi, Joe. We have a couple of questions that have come through.
Oh,
Can you
cool.
talk a little bit about the visa process and has it gotten any easier?
Happy to share. Ron, do you want to go first or?
Sure, I'll certainly respond to that. So has the visa process gotten any easier? I guess is a bit of a matter of opinion. Certainly, the visa process, we would say is not a do-it-yourself process. First and foremost, there certainly is some complexity to the process, and you're dealing with several large government departments. The pandemic has certainly had some impact on the overall visa application and visa processing timeline. That has not been positive. It's been adverse as embassies have been closed down and government departments have been working with reduced staffing. But now that the pandemic is increasingly behind us, we see that is slowly starting to improve. I think what I would say with regards to international recruiting and the visa process is a couple of things. One, it is vitally important that you are working with an experienced, competent, reputable vendor, whether it's with Tom, myself, or another organization. I can't emphasize strongly enough the importance of working with someone who simply knows what they're doing. The demand for nurses, and Joe, you've probably seen this on the domestic staffing side as well, right? When the perception is that there's great opportunity and lots of invoices can be sent out, all kinds of people start entering an industry, and international recruiting is no different. So with regard to visa process, make sure you're working with someone that's credible. That's just absolutely essential. I think ultimately with regards to visa process, my comment would be this: in order to obtain the maximum benefit of international recruiting, it is really important to look at international recruiting as a strategy and not as a project. If you're looking to international recruiting as kind of a one-time fix to an existing problem to help you stabilize the workforce, it's never going to go fast enough for you, and ultimately, I think you will be disappointed in the results. But we've been working with specific clients for 10, 15, 18 years. And clearly, these are the organizations that are deriving by far the greatest benefit from international recruiting, because they have taken a strategic view, partnered with someone who truly has a partnership mentality with them, and to just simply work through and expedite the visa process as much as one can possibly do. There is no magic. There are no shortcuts, No one agency has some secret process that, you know, is a mystery to everyone else. That's nonsense. But simply taking a strategic view, sticking with it over time, working with someone that will help you navigate the vagaries of the visa process, which is evolving and changing. At times it's better and going more smoothly, and at other times there's obstacles to be overcome. So that's a long answer to a short question. I'll stop there and see if Tom has anything.
You know, Tom, before you speak up, I want to capitalize just very briefly on something that Ron brought up, because there was an article in Health Leaders about a month or so ago where, and I won't mention the hospital system up in the upper Midwest, but in the article, the CEO claimed that they had people, international recruits coming in 6 months. And I don't mind saying that I circled up with both Ron and Tom, and we perplexed. That system received a lot of calls from a lot of people, and they had to backpedal quite a bit. International recruitment is not, unfortunately, something that turns around in 6 months. But I am very quick, and I'm sure Ron and Tom are as well, to tell people, if you have this shortage a year ago, you have it now, you're going to have it a year from now. And so to Ron's point, it is indeed a strategy, but realistic expectations are a definitive. And so, Tom, to you, please.
Yeah, no, and I appreciate you both commenting on that. You made a lot of great points. Again, I would sum it up as, is it a quick fix? No. It's a long-term strategic staffing solution that you should use in conjunction with your other recruitment methods. I wouldn't stop all other methods. I would keep that going. We're not here to come in and take over your HR department for you. We're here to supplement that. But as far as, talking about the visa processing, we do a lot of lobbying in Washington, D.C., and we're part of an association that lobbies on our behalf as well. Until they actually turn into law, there's some bills that are out there right now that might help to open up the doors to get individuals into the country a little bit quicker. But again, those are things that are kind of out there in the works and have been in the works for a little while now. So again, until they become law, it doesn't necessarily mean much. But again, it's not a quick fix. It does take patience, but it's something, once you turn on the faucet, so to speak, and kind of start letting it drip, it's going to start flowing through. And as long as you keep committed to it and treat these individuals well, they're going to stay with you for a long period of time.
Thank you. We've got another question in the chat. So it says, we know many hospitals are utilizing international staffing. Would international be a resource for hospice, palliative, and home care nursing?
I'm happy to answer, or Ron, I don't know how you all handle that in your organization.
Yeah, I'll answer briefly, Tom. So in response to this question, the answer is yes, it certainly is a resource. I would say that home care probably is kind of the last frontier in the healthcare system for international staffing. Home care presents some unique opportunities and some unique challenges for international candidates around issues such as the need for guaranteed full-time employment, obviously an immediate need for an automobile and transportation when they arrive in the US. These are all issues that can be addressed, but they are issues that do need to be contemplated. We are increasingly working with local, regional, and even national home health care providers. So the short answer is yes, but it has to be, you have to make sure, again, working with someone that is experienced and competent to ensure that you have a well-developed plan before you set out on this strategy.
No, I'd agree with that. And yeah, the short answer would be yes, we could do that as well. However, what we're finding is most nurses that are wanting to come to the States are wanting to work in an acute care setting, at least is what we're experiencing. So you don't have necessarily that many coming over with hospice or home health care experience that's similar to how things are done here in the States. So we have provided personnel, nurses to those type of environments before, but it's really more so on an acute care setting, long-term care type setting.
Thank you. Another question for you. What if facilities are using other international agencies? How can they work with Qualivis, Conexus, or worldwide?
Joe, do you want to answer that, or?
You're asking what other hospitals?
No, they were just asking, how could they work with us if they're using another international agency?
Well, and actually, I think Ron and Tom both touched on this matter during their conversations, that it's not an exclusive arrangement. Much like Qualivis brings agencies together, we screen, qualify, and vet agencies and make sure that we bring the best, most qualified agencies to bear to the member hospitals of the North Carolina Healthcare Association. If a hospital is already working with another agency, and perhaps probably not within the Qualivis family, that is not an issue, or it should very well not be. If that agency were to tell the hospital, sorry, this is an exclusive arrangement, this is going to be a bit of a harsh response, but I would say to look to end that arrangement as soon as possible. This should not be about the agency. Staffing is about patient care. And so exclusive arrangements, even specifically to international recruitment, are not good arrangements. The hospital needs to make sure they get the qualified healthcare professionals they need. If they're already working with another agency, that would not be an issue. We would be able to bring either or both Ron or Tom and their teams to work to help with international recruitment. Not a conflict.
So I would just add, come at this just from an additional sort of point of view, in addition to the exclusivity, considerations that you just pointed out. But if someone is in the middle of an international recruiting campaign and you're not getting the results that you were expecting to receive, or you're concerned that your existing program isn't performing, we have numerous times been consulted by employers over the years exactly in that situation, where we have come in and just independently made an assessment of the status of their pool, etc. And we've developed actually a very simple scale, rating scale, where we're able to provide feedback on which candidates in their program are a virtual certainty to arrive, which ones are likely to arrive, and which ones are unlikely to ever arrive. So if you're in the midst of a program that isn't performing, before you keep digging that hole deeper, perhaps, reach out again to someone that has industry experience, has worked with and is working with employers all across the country. And if nothing else, just get a fresh set of eyes to give you a second opinion so that you can make a well-informed decision as to what your next step may be.
No, I definitely would agree with that. Our agreement it's non-exclusive, as Joe was talking about. And if somebody tries to pigeonhole you into a corner like that, you need to do what's best for your organization. And I would recommend closely evaluating your terms of the agreement with that other agency.
Thank you. I've got another question that just came into the chat. How do your companies fare with recruiting international nurses to come work in a rural setting where there is no public transportation?
It becomes more challenging. It does become, as Tom said, international nurses first tend to gravitate towards acute care hospitals simply because that's what they're most familiar with. The structure of American long-term care, exists in some forms in some countries, but there's some reluctance for that setting sometimes simply because it's not familiar. Look, every opportunity isn't right for every applicant. but with proper planning, communication, and transparency, there is an applicant for every opportunity. Like home care has some unique challenges related to international. Small and rural facilities have certain challenges, that are unique to them. But at the same time, they're also generally looking for a much smaller number of nurses to be recruited. So again, it's a matter of planning, reasonable expectations, eyes wide open, and a commitment to the process. It can be done.
Yeah, I agree with that wholeheartedly. When we started out, our niche was actually very rural cities, and now we're in quite a few urban areas as well. But our niche used to be focusing on, really, that's where the need was. You'd have new grads that would come in, domestic nurses come in, learn how to practice in a facility, and then move off to the big city and leave them high and dry. So there was great demand years ago in rural America. And we do have arrangements with, many of these individuals, not all, but most of them are able to drive. And we do have arrangements where they can purchase a new or used vehicle. We have arrangements there. I think Ron mentioned that his organization does as well. And they also do great with carpooling, the buddy system. And it just depends if there's no public transportation, no taxi, no Uber, no Lyft. It's definitely a planning situation, as Ron alluded to, that we would just know all these facts beforehand and be able to staff it accordingly. All these individuals know where they're going to be working and sign off on that. We don't just say, hey, you're going here and you're going to like it or not. They buy into it. We want them to. We want them to be happy where they're living so that they want to end up staying there.
Both of those are good points. And I've thought about over the years, both on the agency side and here at Qualivis, where rural hospitals actually made arrangements with nearby housing, literally within walking distance. And you'll find that in many of those rural settings, that the hospital is literally smack dab in the middle of the community. And so it's a lot less difficult than people think. But to both Ron and Tom's point, definitely something you want to take into consideration and make sure that you have arrangements that can be made during that recruitment process. Otherwise, it could be disappointing for everyone, but not as difficult as people would think.
Yeah, just kind of related to this, Joe, an interesting story to share just real quick. Working with an organization in Pennsylvania that actually has vision and the forethought. They're just breaking ground and actually constructing apartments on their campuses, not only to support their international candidates, but also to make that resource available to new grads in their communities that historically have had a pattern of moving away. And they say they see this investment in this housing resource as something that's going to differentiate them from anyone else in the region and make their ability to attract and keep people that much stronger.
100%, Ron. And I know the first thing that might hit people in the face is like, well, there's no way we can afford to do something like that. But when you look at your cost per hire, and a very good additional point there, Ron, not just international, but new grads, even people relocating, maybe for a short-term, opportunity to get started. That investment, be it brand new construction or I have many cases. I even remember in New York City where hospitals literally would buy the vacant building next to them, have it renovated for temporary housing for as long as people needed to, get integrated into the community and find exactly where it is that they would want to live once they get there. That's always a difficult thing with the relocation, right? You buy, you rent a place and you're like, this isn't the part of town that I'd like to be in. And so great point. And again, much more cost effective than people think, especially with that cost per hire.
Yeah.
Thank you so much. And it looks like we don't have any more questions. I want to open it up one last time to the panel for any sort of closing remarks, if you have any.
I'd just say thank you very much for giving us the opportunity to speak today. Should questions come to you, whether you decide to use our model, the Conexus model, or go with Ron's model, I think I'll speak for both of us, where we'd be happy to steer you in the right direction and answer any questions that you might have above and beyond. So if you want to take this offline, we're happy to do so.
Yeah,
Mr. Hoppy.
thank you. Thanks for comment. Thank you, Tom. I echo that as well. And just closing thought, the challenges that each of you that are on this session today face are fundamentally supply and demand challenges. So as you evaluate your strategic options, bear in mind and evaluate each one of them against what they are doing to increase the overall supply of candidates. And one of those strategies that in fact accomplishes that is international recruiting. Thank you for the opportunity.
Indeed. Thank you, Ron and Alex, Jody, Pam, all of the attendees. Alex, I'll let you take us out, but again, on behalf of Qualivis as well, thank you for everyone's time. We're here to help.
And I just want to thank all the panelists for your time and for your expertise. And thank you to everyone who attended today's webinar. If you have any other questions, please contact Jody Fleming. And this concludes today's session. Have a great rest of your day.
Take care.
Thanks, everyone.
Bye.
Bye-bye now.